Your story is clearly motivating, clearly inspiring. What message do you have to impart on healthcare professionals, students, children, aspiring athletes who do look up to you? What's the constant message you throw at them?
It's easy to say something's not possible. And I think in today's society, it's, oh, that won't work. That's not going to happen. Or things are changing so quickly, there's no point even going after it. But if you have a fire lit inside you, go with it. And even if your dream seems impossible, it's not. When I worked in the hospital sector in reactive based medicine, we'll call it sick care, I was so proud of the work I did, but I just had this lingering feeling like, why are people coming for triple bypass? Why are people coming for these otherwise preventable diseases? Yes, in ICU, there's car accidents and accidents that happen, but preventable. So people are coming to the hospital for an otherwise preventable issue. Why? And why are they coming in droves? And why do they need those stents after the bypass surgery? Like, why are we not fixing the underlying problem? Why isn't there just an importance on sick care as there is on healthcare? And so it has been with this thought and being able to get the schooling and experience to be able to bring this clinic to life. And to me, it's just the perfect blend of who I am as a person, athletically, professionally, and I embody everything Health Code Medical does. And I'm just excited for it to reach more individuals. So I would say when there is a will, there is a way. Ultimately, I'd love to be able to speak with policymakers, government officials, people that can invoke change to showcase what work we're doing here and say, this does work. This does get people off their needs and dependencies for these medications. And you shouldn't rely on your family doctor to keep you healthy. That's not their job. It's your job as an individual. You go there when otherwise you can't keep yourself healthy, but you can't expect the system to take care of you. You have to take care of yourself. And that's seen in every aspect of life. Financially, nobody's looking after your financial well being. You have to take care of it. You have to invest accordingly and educate yourself. I would love Health Code Medical to be that trusted source as we enter this new frontier of medicine that's bringing in all of these technologies, all of this awareness, and then organizing it in a way that gives you a plan. Because otherwise, it's all siloed and there's just so much data, it's hard to know what direction to go in. So it's being able to take the noise out of it and just provide precision health for you. So is it a keto diet? Is it this much sleep? Is it what for you? What does that mean for you to get your health back on track and to optimize your health?
We're truly moving past the world of bro science to measurable science, aren't we? Like,
Yeah.
really, like with wearables and technology around us, there's really no need to guess anymore, is there, Lisa?
No, but it's being able to tie that in. And
Mhm.
so there's so many fascinating technologies out there. So we think of sensors in a toilet, and now you're seeing how hydrated or dehydrated you are, or a level of sodium. That is such an important measure for somebody with heart failure. So if you're able to take that number and then tell the individual, oh, you need to do X, Y, and Z today, which is good because I don't want to see them come into emergency with their lungs full of fluid or their ankles swollen. And people with heart failure are really ride a very narrow line in terms of what they can do in terms of their sodium intake and their fluid balance. And that was just one example. So often individuals seek the urgent care and then they leave, but they don't actually wonder, maybe I didn't need to have that episode to begin with. That's the underlying, that's the foundational piece. We don't want our bodies to need access to urgent or emergent issues. We just want to keep it in this nice, safe zone as we go through the different stages of life. We're optimizing, preventing, and working within that lane. Because if we're continually getting sick and one extreme to the other, our body is it's being worn down when it's unnecessary. You could just prevent the plaque from building up to begin with.
Mhm, mhm. Lisa, as we wrap up our very enjoyable hour together, I thank you. Is there anything that I have not asked you about that you want to throw on the table for our audience to be aware of about Health Code Medical or about Lisa Brooking?
Mm, Thank you for that. Couple quick things is people say if there was one thing I can do for my health today, what would that be? For one, I think it's find out more about your health, which we help you find out more about your health so you can make more proper decisions moving forward. Movement is medicine. And so it
Mhm.
doesn't need to be fancy. It doesn't need to be a fancy gym membership or anything. It just movement is medicine. It gives you those wonderful endorphins. It just breathes so much life into our bodies and excretes all those toxins out our pores. So movement is medicine. And thirdly, we use in society, we are already harnessing aspects from around the world. So could you imagine if you could only buy a car that was made in Canada? When we love the luxury of being able to buy international vehicles and technologies and such like that. So with healthcare, why wouldn't we be able to harness different lab tests and people who are really on the cutting edge? And so being able to bring that into one place is so important because the whole world is trying to solve cancers and Alzheimer's and cardiometabolic diseases. So why would we just stick to what's available in our own country? Why not see what other great technologies are out there so that globally we can improve the health for all?
Inspiring, Lisa. I was
Thank
trying to find the right word and I just ended up on that one that I started my day with, which is you are very inspiring. I really enjoyed hearing from you today and the journey that you're on. Thank you for joining me and my audience today.
Oh, thank you very much for having me.
Absolutely. So I'm just going to throw it into the green room. I'm going to say goodbye to the audience and come back and walk you out of the lab. We hang around for a minute.
Absolutely. Thanks.
Awesome. Thank tight. And I'm not looking at the right camera right now. I just recognize that. So I'm going to do that and try that again. I'll see. That's how this thing works. You get the live stuff, then you get the post show stuff. So those of you that watch this live, you got to see my profile. Those of you that have seen this in the post show, I'm just going to say, you missed what happened earlier. We'll see you guys tomorrow live in the lab. I'm here Monday to Friday, noon central. I'm out of here.